Now for the most exciting part, which is our guest panel. I am going to first turn it over to Bert Rios, who will share about implementing living well with youth in Arizona. Bert, the mic is yours. Thank you so much for joining us.
Thank you so much. This is Bert again. Welcome, everybody. We implemented the Living Well here in Arizona in Spanish and English, but we did it for transitional youth and also young adults. The process was they were going through a transition of their independence for turning 18 or over, and they needed assistance in how to become independent and still keep, work abilities and living skills and all that. On the average, we had a total of the sessions we did about 50 individuals, and we discovered that with these other agencies, the training is possible for employment, but there's independent living skills, coping skills, that they would drop off after 90, 120 days. So implementing the Living Well helped them to develop those skills of, health, about activities, about these barriers that we made objectives, and then they turn into goals and work as a group, but also as being independent on needing transportation, whatever the issue was. So they had a better successful rate as health and also being independent after the basic skill trainings for employment, but also at the same time, we came across some of them were young adults that already were parents too. And that was part of the process too, because some of their objectives, babysitting and all that. So it's a culture diverse kind of living well for the area here in the south of Yuma, Arizona. It's more farmland and immigrants like that. So my advice when you do any kind of independent living skill, whether it's the culture diversity, the age group, and come across and teaching that diversity, and also being able to express the awareness of, giving them that insight about how we could live healthy, but also how we can manage our goals and balance our quality of life through living well, and continue the peer mentoring also, because we had some individuals from there that want to be facilitators and process that. And it was I feel very honored that some of them went ahead and with their families developed those skills that also managing, even though they had children, parents who were young in their 20s and some 25, that they were able to manage how to do some of that and the encouragement through the Living Well process. But we also, to let you know, we also done it for the elders, Spanish and English. We've done a couple of varieties, individuals. But I think the most impact was for us here was the young adults and the transitional youth, because there's really nothing to do that transition about adulthood, independence, benefits planning with the Social Security issues and all that. We help them with that. So, and also understand with the parents. So I think that would help with us a great impact here in our community.
Thank you, Bert. It sounds like you really adapted the curriculum to really meet the needs of the community, which is exactly what I'd love to hear. That's great.
Do you want me to take questions or anything right now, or are we going to proceed?
Sure, yeah. If anyone has any questions specifically for Bert, that would be a great time to ask. Like we have some folks typing in some questions. The Independence Center asks, Bert, how do you reach out to your youth for this program?
We have several collaborations with the Transitional Youth District, with the Department of Economic Security, which is part of the disability process with some of the youth, and we outreach to the high schools, but also the ones that I reach out was a lot of the job centers, the ones that work with people, vocational rehab with the young adults, also with here they call it Arizona Workforce, which is turned into a whole helping individuals for employment, and that's some of the trainings we did for them, the young adult and the transitional youth ones. So that's the outreach we did, and we take care of two areas, well, two counties here, Yuma County and La Paz County. La Paz County is very rural. In that area, we work with the high schools, but also with individuals that work with employment, or they need some independent living skills that we provide. And I found that, even working with the Native Americans, we did a training with the Native Americans over there for one center that was for hypertension and diabetes, and we had some facilitators there and everything that carried on that. So we try to do as much outreach and go to different places where we see that they could, have some of this training for the life skills, because actually they do move on if they have those coping skills, life skills, independent living. Plus with the Living Well program, and I might say the Working Well program too, both of them are just great assets for individuals to keep going and achieve their goals as the process of disability, and that they have the empowerment that I just find them amazing how they could continue doing that, and they don't feel isolated. But everywhere that we can, most was just going to other agencies and seeing the needs, and they were willing to try the Living Well program here. So, and that's where we were successful with that. And again, the basic thing is culture diversity. We did it in Spanish as well as English, and you have to go with your community of what you need and how to implement that and be diverse in what you do that.
Thank you, Bert. That's wonderful. We have another question, which is, what was your process for finding and recruiting facilitators?
And that process was, as we went along and did some Living Well with individuals, they wanted to participate and as facilitators, and that's how we got our facilitators, because we were able to put on several programs, and they were interested in not only becoming part of the process with individuals in the Living Well, that this was some of the things they wanted to do in their quality of life of implementing Living Well as they're doing it. So the recruitment really came from the individuals that went through the Living Well that wanted to be facilitators in Spanish, English, or young adults and things like that. That's who that's how the recruitment came from that.
Yeah, it sounds like the peer model really worked there. Thank you, Bert. Another question is, did the program get written into their individual employment plan, and could the participants be paid during the training as part of their employment?
The contract with them was part of their plan, the employment plan, just like vocational rehab and job center. So it was a combine of agreeing to the session to help them with the process of their training also. So it was inclusive with the contract we did was it was part of that process. So it was all in like a one deal thing that we did with them, and that's how we were able to do the process, because they felt really this is helping, because the statistics they were showing within 90, 120 days, the basic training of their skills and everything, they were not moving on with that, because you show that they're missing those independent living skills as well as Living Well process of how to cope and how to manage their life. And they found out it's more successful with that process of going there, because they were stopping at 90, no more than 120 days. They were dropping out because of benefits or because of this or the coping skills. So when we showed them the results of if we do living well with them, at the same time, it would help them continue on for their long-term employment as well as their life skills and everything else.
A related question from Mickey Hill is, did you see any data or indications of positive health outcomes for these youth in transition? And did they have fewer incidents of depression, anxiety, and or ER visits, or any other measurement? And it sounds like you saw some definite positive changes, but I guess this question is more about measurement for those changes.
The only thing, we did a 3 months post-survey of where they were at after the sessions, and it was really just data of, what their lifestyle is, how they're doing, just a kind of a follow-up. But it seemed that they were actually less, related to, they're still employed, they're still working, they're still, looking at, like some of them want to be interested as facilitators and all that. We did a 60-day, then a 90-day, and see how that process went. But it was just questions about their quality of life and what has changed, what is new, and things like that. But in the survey, we looked at, some of the questions were like depression, anxiety, and things like that. Have you seen your doctor? Things like that. And we've seen that not much of the individuals that first were going in the few days, and then by the 60, the 90-day, when we asked those questions, it reduced that. They weren't seeing their medical doctors as much because of the anxiety or depression. They had already got their own medical and working on things, their priorities of, buying a house, a vehicle, moving, school, education. So it helped their anxiety and depression was lessened by them going to the Living Well program and meeting those, individual barriers that they could accomplish with support of the community, as well as following up with us on the independent living skills.
Another question, Bert, is that you mentioned you taught coping skills. Does the Living Well program use its own curriculum to teach coping skills, or are you using curriculum created by other resources?
The coping skills was basically that we did was from Living Well of, what's your barriers? And the barriers we turned to objectives and reasonable to achieve a goal, and showed them how, the journey goes from, I have a barrier of transportation. What are the objectives to get that transportation, public or private, or how we do that? So they could see a process of the solution as we go in problem solving to do that. So as part of that, but also connecting with the resources of, that they have a special discount for people that are disabled, a pick up here, the destination. So kind of empower them to utilize the community resources. And it was mostly through Living Well about, the problem-solving process that they learned that skill. And that went with anything about medical doctors, about education, things like that, as well as helping them understand that there's limited resources, but there's also other resources where they need to go and find these resources. And it's part of their process to empower them and feel, independent to do that.
Excellent. Thank you, Bert. Any other questions for Bert? All right. Well, we can take any more questions also after we conclude with the guest panel. So
Maggie?
thank you. Yes?
Sorry, this is Tracy, and
Yep.
I just had someone raise their hand, and I'm wondering if they have a question. And
okay.
I think I hear somebody unmuting themselves, and so I'm wondering if that's the question.
Thank you, Tracy. Is someone trying to ask a question with the mic?
Can't quite tell, but it does sound
Yeah.
like somebody is unmuting themselves.
Okay.
So, if we can, it's just some background noise. If you have a question, please go ahead and ask it. Otherwise, we'll keep the lines muted.
Hi, can you hear me?
Yes.
I'm sorry, it was me. I'm trying to sort this all out here, and I was typing furiously, but I'm not that great at it.
Oh, that's okay. Yeah, that's fine.
This is Dave Hoffman. I'm with Center for Independence, Western Regional Office in Montrose, Colorado. And my question is we cover an area the size of Connecticut. Most of our communities are far flung. Some of us, it takes a 2-hour drive to get there to service one consumer. So, practicality-wise, I know you've mentioned training someone up, to be there for these people. That's a lot easier said than done. The agencies and services aren't always there. Is there a vehicle or is it an option to do something just like we're doing now with either Zoom Room or GoToMeeting, Adobe Connect, anything of that nature, so we can actually still provide some training as a group overall, to work. I really like what you've got here. I think it's an excellent program so far, but I'm just thinking logistically wise. Does anyone else have any issues with that, or anyone has conquered that problem?
Yeah, thank you so much for your question. I'll open that up to our guest speakers and see if they have any experiences to share about that.
This is Jude Monson from Summit in Missoula, Montana. I sure understand the geographic nature of Colorado and what you're trying to do and the question that you're asking. We have 7 counties in our western Montana region, and we committed to having offices in 3 other counties other than Missoula. And so we have gone about it that way in terms of having county staff who can offer this both in the office or at a community center.
Thank you, Jude.
This is Dermot in Laramie, and when you're talking rural, I sure understand that too. We cover the entire eastern half of Wyoming, so if you divide Wyoming in half, we've got half the state. And we run into that situation a lot where you're driving hours just to see one consumer. And the way we've done it is we do have staff that work out of home offices. We have 4 storefront locations, but the rest of the coverage area is provided through specialists that work out of home offices. And what they're doing is looking for opportunities where they don't have obviously an office to provide a meeting place. They partner with senior centers or churches or American Legion Hall, whatever, in communities that are fairly centralized or at an easier place for people to get to. And they just vary the venues for the offerings. Now, that's not going to solve everybody's problem, but it sure makes it more accessible. We believe, and we've seen, that there's power in physically getting people to sit down in the same room. And technology, of course, is wonderful. A lot of our folks are a little reticent to use the computers or to do it that way. We also have connectivity issues when we try to do counseling or just visits, virtual visits. So what we do is we try to encourage people to physically get together, and by getting as close in proximity to them as possible, and then working with them maybe through our transportation program to enable them to get there, that's pretty well received.
Thank you, Dermot.
From Montana.
Oh, sorry.
We've worked a lot with that, too, in the rural counties. We have 17 counties that we cover. And one thing that's really successful for work in a collaborative manner with our community partners that also have offices in the different areas. For example, several years ago, we collaborated with the Center for Mental Health and for one of the rural areas, and were able to teach the course as they provided us communication and whatnot, opened it up to their clients and others, and it worked really well. And so a lot of times if you can help other community partners know that's available, we usually ask that there be at least 4 people signed up for the training that are solid to commit, and then we'll go to them and we have that, and usually they'll provide work with vocational rehabilitation. Some of the tribal agencies go out and provide it where they're at. They help us out by providing us location and games, whatnot.
Thank you so much, everyone. Those are all really excellent answers. I'm going to just ask that everyone who is a participant just mute their lines once again, except for Dermot. Dermot, I'm going to turn the mic over to you.
Okay.
And Dermot will be sharing about incorporating Living Well into a larger independent living skills training network. Go right ahead, Dermot.
Okay, thanks. Yeah, we've been doing Living Well with a Disability here out of Wyoming Independent Living for about 10 years, and that predates me, so I'm not sure exactly how far back it goes, but it's approximately 10 years. And I know that the past 8 years, we've really beefed up our efforts to offer that in as many communities as possible. So we've mandated that all of our IL specialists, all of our independent living specialists, are certified to teach the Living Well with a Disability class, and several of them actually are certified to teach the Working Well with a Disability class. But that's been beneficial as well. And what we found is that in addition to just the benefits that Bert discussed, and boy, Bert, everything you said, I can just say we share so many common experiences with the benefits of the program. I really appreciate your input, because so many of the things I thought, wow, we're seeing that here as well in Wyoming. But beyond the Living Well workshops, we're seeing that the impact that it's had on our staff has been to make them better equipped. They understand the IL philosophy a lot better now. And of course, as a Center for Independent Living, more than half of our staff are persons with disabilities, but understanding that whole philosophy and the whole nothing about us without us kind of thing, and the power in peer support and all those concepts, it really helps solidify that. And it comes out in every program that we offer beyond just independent living, but it comes out in our nursing home transition, it comes out in our case management, it comes out everywhere. And those are all good things, because really, when it comes to getting away from the traditional agency mode of you come in and a consumer is seeking services and we're here as a professional to help you and fill out all these forms and jump through all these hoops, we're approaching them much more from an orientation that says, hey, I get it, I'm with you, we share in this life's journey together. And the whole thing about empowering people to do for themselves and to really take ownership comes through very strongly in the literature. So a lot of the concepts we take into our skills training, and we're offering things like financial basics, health and wellness programs, relationships in the community, capacity building, fix-it skills, employment, soft skills preparation. Those types of things are coming through, and so what we're seeing is more of an outreach that has been impacted by just the concepts in Living Well. When it comes to the Living Well programs in particular, we have currently there are 4 communities that are doing Living Well, 2 more that are going to be starting up later on this year. So what we do is at our centers is we offer them on a rotating basis. We try to offer 2 or 3 Living Well classes a year if we can from each of our centers. And then if there's more demand, then we definitely beat that up. But big draw comes from the Voc Rehab offices. We really try to partner with Voc Rehab as much as possible to let them know that we can work with their clients on improving their soft skills. Because as Bert said, so many of these folks, they may be struggling with just basic life organization skills, just getting up in the morning, finding transportation, getting dressed, making a healthy meal, all those things that we take for granted may be a challenge for some people. And Living Well really does help bring those things to bear and to really look at how do I move through the problems, how do I move through the barriers that I'm seeing. And once those things are addressed, they're a lot more successful in employment and just in life in general. So the feedback that we get from consumers and from the VR counselors is very positive, and it just really has a beneficial impact on so many areas of life. The other thing I wanted to mention is that one of the questions that came up earlier was where do you get your facilitators from, and since all of our IL specialists are Living Well certified, they are co-facilitators, but we draw, like Bert mentioned, from within. And in each class, we are looking for people that really show an interest and express an interest in coming back and co-facilitating. And we've had people that have taken the class multiple times and have stepped up and said, hey, I really want to give back now, and now they're co-facilitating. And as a result, we even have employees at our center now that started off years ago in a Living Well with a Disability class, and now they're actually specialists that are working in our program, and they really, talk about perspective. They really, really bring a wealth of perspective to that because they were actually cultivated and brought up through that whole system, and it's been very beneficial. Those are my comments. Yeah.
That's awesome to hear. Thank you, Dermot.
Sure.
Any questions specifically for Dermot? It looks like we have one question. I'm not sure if this is for Dermot in particular, but anyone is welcome to speak to it. Do you get a fee for service from vocational rehab for this program?
We at WIL, we do not. We offer that as just part of our services. We look at that as very much in line with our core services as a Center for Independent Living. There has been some discussion for the Working Well program possibly going that direction, but we haven't pursued that yet.
This is Bert in Arizona. We contract with Voc Rehab and the Working Well. They do provide fee for service for us when they have clients for needing that part.
This is Jude from Summit, and yes, both Living Well and Working Well have a fee for service, and Voc Rehab and home and community-based services have paid us for this kind of training.
Great, thank you all. Any questions specifically for Dermot? While folks are typing, I'll just wait for a second. We have a question from Karen, which is, what do you charge for the classes?
At Wyoming Independent Living, we do not, so I guess I'll have to defer to Bert and Jude on that.
This is Jude. We request $500 per class. In addition to that, because home and community-based services is funded through Medicaid, they may not be able to pay us at that rate, so we go with whatever their going rate is.
This is Bert. For the job services, we're doing $250 per individual, young adult, and transitional youth. And the Voc Rehab, we have a contract that we get any services we do with them. It's $65 an hour for services that we provide, IL skills as well as living well.
Thank you. Any other questions for Dermot? All right. Thank you so much, Dermot. I will turn it over to Jude, who is going to share about capacity building to support a program like Living Well. And go right ahead, Jude. Take it away.
Thank you. First of all, it's just fun for me to listen to Dermot and Bert talk because it just tells me how independent living centers have so much in common when we follow the same philosophy as well as the same core services. And so that was just fun to listen to again. And then in addition to that, by taking the Living Well and Working Well facilitation training, there's some commonality that all the facilitators have, and there's some basic pieces that we found that not every new training has, and so we use Living Well and Working Well facilitative training as our baseline of how to assist any facilitator in the future. Summit has been involved since the beginning because we are in the same town as the Rural Institute and the University of Montana, and so we've been honored to work right along with them in their development and then the publishing of their curriculum as well as the facilitative training. In addition, what I would just say is that over the years, what we have seen is very similar to what the other centers have experienced, which is our independent living specialists are often asked to take any kind of training like Living Well, Working Well, and other skills training so that they can be available not only individually sometimes, but to groups. And so it's a good foundation to start from. I've also felt that from each of those groups, we have seen certain people who have taken it and we've kept an eye on them, asked them to take other trainings and see if they really are folks who listen and are aware that other people have some of the same not only goals but also problem-solving ability and recognition of that if all of us are working together, we sometimes can do more than what we've done individually. And so we like to watch that group process and see who might become future leaders. Many of them come through our peer program just because of that. And sometimes they don't want to do the facilitation of classes, but they might do some other group kinds of meetings. And we find that really works well with the Working Well chapter on the power of advocacy. A couple of other things I'd just like to say. I mentioned earlier that our main office is located in Missoula. We have 7 counties, and in 3 of the other counties, we have hired staff, small amount of staff, but also grown our peer programs in each of those counties. And so the staff and peers in those counties will determine, what they can offer within their capacity. So in Flathead County, which is up by Flathead Lake and Glacier National Park, we have a lot of people up there, not as many as Missoula, but it's growing very fast. And we find that is our second county that offers Living Well and Working Well throughout the community, but oftentimes in our office where people might come and ask for other core services. and we refer back and forth not only amongst people who come in, but also we advertise consistently with vocational rehab, home and community-based services, our local rehab center, hospitals, and we post flyers and we put it on our Facebook. We do a lot of the social media stuff to just advertise that when our classes are starting and the length of them. And we usually do the topic right along with those classes so they can see look at it. I really appreciated that Bert talked about youth. We've had one school that really is interested in committing 10 weeks or 10 sessions. We have yet to be in that school to pull that off because of some of the pre-ed changes, but we're still looking forward and having that conversation. I see it as really valuable for the 18 through 24-year-olds, both living well and working well, and it is a kind of a start for some of the soft skills and other training that's available out there. We have people who have been 18 through 80 who have taken this class, and it's been fun to listen to their different life experiences and to share, again, from that peer perspective, whether it is invisible or a visible disability, along with just hearing the experience of age in each group. There was a question that I had noticed about do we always use with a disability, and that's a very interesting question. We could just say living well or working well. I think that because we're independent living centers, we prefer to use and like the terminology of living well with a disability, working well with a disability, because it brings that to the table right away. And I know especially for people with invisible disabilities, it's more difficult to talk about some of the things that maybe we haven't talked with outside of our family or our friends. And by coming to the group, it's just then agreed on that we will share as we feel comfortable about any invisible disabilities. We have served folks who have obvious disabilities as well as folks who have had diagnoses of mental health as well as folks with progressive diagnosis, and then people who are aging and have discovered that some of their health problems have become not only just chronic, but they're really dealing with some specific issues as they age. And all of it has been very helpful, and it doesn't matter that there's a mix in any group, because people are really talking about that transition and life goals and sharing resources with each other. I can't say enough about that information and resource piece. And out in each of our counties, what I would say about that is, as we all know, whenever you move 60 miles away, there's another set of resources or lack of resources. So it's really important for each community to be able to talk about their resources. I think I'll stop there and just see if there. Oh, I did want to mention one other thing. The self-assessment I mentioned before in regard to the facilitative training, and that has been a value as a staff and as a supervisor to have anyone in our center who has taken the facilitative training to be able to assess themselves and really talk with their supervisor what things they're growing in, because many people, we offer well and working well at least twice a year in any of our counties. So now I would open it up for questions.
We'll see you in 2 hours.
Excellent. Thank you, Jude. Just a quick reminder before we open it up for questions, please mute your phone line by pressing star and then pound, and then use the chat box to ask a question. So Pamela asks, are peer facilitators compensated for leading the classes?
At Summit, they are. Our peers have the choice to either volunteer their time or to be paid, and most choose to be paid, especially with the Medicaid for Workers with Disabilities option now. And so they are paid at a rate that all our peers are paid through Summit. And they are paid by the hour, not only for their prep time, but during the class. And then the time that they meet with the supervisors after that class, and if they are responsible for any of the contact notes that are needed.
Excellent. Thank you. The whole person asks a question about working well. I'm going to return to that after we conclude with our guest panel. Any more questions specifically for Jude or for any of our other panelists?
I just wanted to follow up with that question.
Mm-hmm.
The reason, one of the ways that we are able to pay for our peers' wages is when we do get fees for services, and we've been very upfront about that's a way that we can increase our capacity.
Great, thank you. Other questions for Jude?
Maggie, this is Tracy, and I've been fielding some of the questions coming in through the text chat, and I think we can address some of those now. So the first question, and these are sort of in order in which they came in, how do you become Living Well with a Disability certified? Maggie, do you want to answer that one?
Sure, yeah. So the first step is for an organization to sign up for organizational access to our facilitator training by purchasing a license, and then up to 15 facilitators may go through the training and then put on workshops themselves. So each facilitator becomes certified once they complete the training.
Great, thanks, Maggie. And a follow-up question to that is, once a facilitator is trained, will they need to maintain their certification? And I'm happy to take that one on. So just as the history of the program stands, we haven't been really tight on making sure that people are recertified in any capacity. Partly that's because there has been a lot of turnover. So as soon as our primary service delivery partners, Centers for Independent Living, have new staff to get trained, they get them trained, and then they conduct the workshops. That said, it is recommended that anyone who gets trained conducts a workshop within 3 months after going through the training, so it can help them retain and use the new knowledge as soon as possible. And then also, if it has been more than a year since someone has conducted a workshop, or if they haven't been able to conduct a workshop since getting trained, we do advise that they retake the training. And all of the facilitators that go through the training are very encouraged, and we kind of automatically sign them up on our program listserv. So they get any updates and announcements, which is important in terms of whether or not there's an opportunity to get an update training. So if we've changed anything in the program, content, the curriculum, or the delivery method, we can communicate with facilitators in that way to make sure that everybody is up to speed. But the short answer is there's no recertification mandates right now. We kind of trust people to gauge when they need to have kind of refresher as a facilitator.
Great, thank you, Tracy.
Next question is, how do you add more than 15 facilitators if it's needed? Maggie?
That's a great question. We currently, if that is your situation, we would ask that you reach out directly to us, and we can work out something with you directly. Do you have anything to add to that, Tracy?
I don't think so. I think that as long as the answer is sufficient for the person who asked.
Mm-hmm.
Okay. Next question. I think I'll take these two questions because they kind of coincide. So one question was, is the living well with a disability the same as the living well with chronic conditions? The answer to that is no, it is not. Living well with chronic conditions is kind of a spin-off name of Stanford's Chronic Disease Self-Management Program, which you may have heard of and are familiar with. The way that Stanford's program works is the real name of it is the Chronic Disease Self-Management Program, but then they give opportunity, at least in the past, for program implementers to kind of name the program something else. And so throughout time, there have been these different names assigned to that program, such as Living Well with Chronic Conditions. So it is not the same program. And then the follow-up question to that was, how is the training different from Stanford's chronic disease classes? And I believe what you mean by that question is, how is Living Well with a Disability different from the Stanford program? And the content itself is different, of course, the curriculum itself. The Chronic Disease Self-Management Program, our experience has been that it's really geared towards people who are ready to do health self-management, whereas Living Well with a Disability kind of takes that a step backwards, just in the timeline of people's readiness to even start thinking about what does it mean to self-manage one's health. That's why we, within the Living Well program, focus on setting quality of life goals and say that, health is a way to reach your quality of life goal rather than setting a health-related goal in and of itself. So a Living Well participant, a Living Well with a Disability participant might have a quality of life goal that is, I would like to be able to travel across the country and fly there to meet my new grandbaby. But my health is getting in the way because, I have this health condition that makes traveling problematic. So the quality of life goal is to travel. And then the Living Well with a Disability program helps teach the skills to, self-manage one's health in order to reach that quality of life goal. The Chronic Disease Self-Management Program is similar, though it is more geared for people who are ready to self-manage, their health condition right then and there, like, manage my diabetes or manage, my arthritis. That's kind of an example of how they're different, but they are similar. And then Jude kind of spoke to, the focus being on, originally people with physical disability and mobility impairments. That's where the program originated from the research and is evidence-based for that population specifically.
Great. Thank you, Tracy. Go ahead.
A couple more questions coming in. Go ahead, Maggie, while I kind of look at these.
Sure, yeah. I just saw a question about working well with a disability. And the question is, do you need certification for working well? Yes, it is a separate training. You can, you don't have to do both trainings. Like, for example, you could just do the Working Well Facilitator training if that would work best for your center or organization. And that is a little bit of a different process. We offer that training, facilitator training, twice per year, and it takes place through an online classroom, and it's a week long. And the one that's coming up is actually September, 18th through the 22nd. And you're welcome to email us with any questions about working well. And our program website kind of just goes over the details of how to sign up for that. And yeah, so if there are any questions specifically about working well, feel free to email me and I can get you more details about that.
Great, thanks. Another question coming in from Anne, and I've spoken with Anne in Wisconsin about this before. She asked that I share, for those who are interested in training, how we are proposing to keep the synergy and momentum going by hosting conference calls with trained facilitators. And thanks for that prompt, Anne. Yes, so one of the things that we are doing that's newer to the program, because we have transferred the facilitator training as a completely online self-study, is to make sure that we're still engaging trained facilitators and giving them opportunities to touch base with us and also with their peer facilitators throughout time. So what we're doing is fielding technical assistance requests from trained facilitators on different topics that might come up, such as recruitment or, actually facilitating with groups that have different age populations within it. Anything that really comes up from in the field practice that people want to talk more about. Certainly we have a list of topics that we've had kind of come to us in the past, and we'll be featuring those on probably quarterly or more often if needed, technical assistance webinars that all trained facilitators will be invited to participate in and join if they're interested in that particular topic that's being discussed at the time. And these are no-fee technical assistance webinars that we'll be offering to those programs who are licensed program providers of the Living Well with a Disability program.
Great, thank you, Tracy. I see a question here also about cost, and the question comes from Christine Nelson. And it's $500 per organization to get training online, or $500 per person who wants to get trained. So to clarify, for Living Well with a Disability, for the online facilitator training, it is a $300 cost for an organization to purchase a license, and then 15 people can go through that training. So that's the $300 is the base cost for that. So you don't have to pay per facilitator. For Working Well, it is a little bit of a different structure. That is $130 per person registering to do the facilitator training, and that includes a facilitator manual and covers the cost of that 1-week class. So those are a little bit different fee structures there. I hope that answers that question.
Mm-hmm. And this is Tracy, and I also think that the $500 amount may have come in because I believe, Jude, it was you who said that's what you charge consumers to participate in the workshop at your Center for Independent Living. Is that correct?
Yes, that's correct.
Okay.
I did want to mention one other piece that we use with our staff and our peers who are facilitators. At the beginning of each class, we also ask our facilitators to set their own Living Well or Working Well goal for that particular 10-week time so that they can be the example. And I know that that's said in the facilitator manual as encouraged, but I really find that, as someone mentioned before, that's what keeps our facilitators maintaining their level of skill in recognizing, the work that it takes to go about this, but then also at the same time leading and facilitating that group through their goals.
Great, thank you, Jude. So we'll just answer a couple more questions here. We have the question, what is the focus of Working Well with a Disability? The focus of Working Well, it really builds on the content of Living Well and considers health in the context of employment. So participants in the workshop learn skills really to maintain life balance, manage stress, and improve their health in support of either looking for or maintaining employment. Other questions as we wrap up?
One final question about Working Well, Maggie, is do you need certification for Working Well with a disability? And
yes.
By that, I don't know if it's organization certification or individual certification. So.
Right. Yes, I can answer that. So for a facilitator to be certified, they need to go through the training for Working Well, which we hold twice per year. And then once they complete that training, they're certified to put on workshops of their own.
This is one comment that I thought maybe we should highlight, and this was from Ann in Wisconsin, too. She said, for those who want to reach out to community health system partners, it is great to speak about living well with a disability as a benefit of health promotion and prevention. The age group that Jude spoke about, 18 to 80, is the same age range as Special Olympics. And she said, good stuff with opportunities for health promotion and healthier person. So I just want to make sure that that comment was noticed by everyone as well.
Thank you for highlighting that. It looks like we have a question from Craig. Do we have any YouTube video samples of a class presentation? We do not, as far as an actual workshop. We do, in the facilitator training, we do have videos of facilitators talking about what it's like to facilitate and kind of their experiences and what they think is important. But we don't have any videos of actual workshops. I hope that answers that question.
And that being said, as a follow-up, that's something that we have, as a program, have wanted and asked for from other program providers. Though I think it takes a little bit of planning and organization. But for our speakers that are participating today, Bert and Dermot and Jude, if you ever do have that opportunity to videotape or record some of the sessions with the consumer consent, we would love to see that and even feature it as part of the program promotion and just that kind of provider peer support on our website and make that available to the broader audience.
This is Bert. That sounds great. We have our session, see if we get something like that and send it to you.
Awesome. That sounds great. And Jude, we could also come to you. You're local, so just let us know.
Thank you for reminding us. Yes, we'll be in touch.
All right. Well, I'll definitely follow up with that, and then I'm going to turn it over to Maggie to kind of wrap things up.
Well, thank you, everyone, for joining us today. I really appreciate it. I'm excited to see how much interest there is out there, and so excited to hear from Jude and Dermot and Bert about how they're implementing and their experiences in different settings, and really like how they're making the workshops their own. So thank you so much for sharing with us today. And if anyone has any questions, feel free to email either me directly or livingwell@mso.umt.edu. There's also a link here to the Living and Working Well program website.